Hello everyone, welcome to another video. So in today's video we'll be looking at another topic. So today we'll be looking at leishmaniasis. So leishmaniasis is a parasitic infection and it's particularly caused by the protozoan parasite known as Leishmania, hence the name leishmaniasis. So it's particularly spread by the bite of an infected female sandfly, specifically the phlebotomos or the Lusomia species. So the sandfly becomes infected when it feeds on the blood of an infected person or an infected animal like dogs, rodents, or like wild animals like tigers or lions. So leishmaniasis is common in the tropical and the subtropical regions, including Africa, Asia, the Middle East, Central and South America, and some parts of Southern Europe. So how exactly does this Leishmania parasite affect the body? So the Leishmania parasite enters the body through the skin when the sandfly bites the person. So it infects the macrophages. The macrophages are the body's immune cells that normally fight infections. So it infects the macrophages and it multiplies inside the macrophages. So the infection mainly affects the skin, the mucous membranes like the mouth and the nose, the internal organs like the liver, the spleen, and the bone marrow, depending on the type of leishmaniasis, because we have different types. So basically the immune system struggles to control the infection, leading to the damage seen in the skin like ulcers. Then there can be enlarged liver, spleen, or like damages to the blood system like anemia or having low white blood cells. So looking at the types of leishmaniasis, so we have three types. The first one is cutaneous leishmaniasis, and this particular leishmaniasis affects the skin. So it's the most common form, and it usually causes painless skin sores or ulcers that can leave scars. So we have cutaneous leishmaniasis, and we also have mucocutaneous leishmaniasis. So this is the second type, and this type, according to the name, mucocutaneous, so it affects the skin and the mucous membranes. So cutaneous affects only the skin, mucocutaneous the skin and the mucous membrane. So it usually starts as skin ulcers, then it spreads to the nose, the mouth, and throat, destroying all these tissues. Then the last one, we have visceral leishmaniasis, also known as Kala-Azar. So it affects internal organs, and this is the most severe form of leishmaniasis. It causes fever, weight loss, enlarged spleen and liver. It causes anemia because it's targeting the internal organs, and it can be fatal. This visceral leishmaniasis can be fatal if it's left untreated. So we have three types: cutaneous, mucocutaneous, and visceral. So for the causes of leishmaniasis, the infection is caused by the Leishmania parasites, and different species cause different types. So it's particularly spread by the bite of infected female sandflies, and risk factors can include living in or traveling to endemic areas, having a poor sanitation, poor housing, whereby sandflies breed in like the dirty areas or dark places, and also malnutrition too is a risk factor, and having a weakened immune system, because once your immune system is weak, it usually makes any infection worse than is meant to be. So having a weakened immune system, whereby for example the person has AIDS, so HIV or AIDS, so this is a major risk factor. So for the pathophysiology, So like I said, the sandfly bites and injects the Leishmania parasites into the skin. The Leishmania promastigotes. So it injects these promastigotes into the skin. So the parasites are taken up by macrophages, where they change to a mastigote. So a mastigote will multiply inside the macrophages, causing the skin ulcers in cutaneous leishmaniasis, mucosal damage in mucocutaneous leishmaniasis, and then organ enlargement, anemia, immune suppression in the severe ones, visceral leishmaniasis. So all these symptoms start to occur when these mastigotes are multiplying inside the macrophages. So the body's immune system is often not strong enough to clear the infection fully. So looking at the signs and symptoms, so for cutaneous leishmaniasis, we'll see painless skin sores. It can be single, it can be multiple. Then the sores may start as small bumps and progress to open ulcers with raised edges. Then they may heal slowly and leave scars. So this is for cutaneous leishmaniasis. Then for mucocutaneous, that affects the skin and the mucosal membrane. So there will be presence of nasal congestion, nose bleeds, difficulty breathing, destruction of nose tissues, mouth tissues, throat tissues, and it can cause disfigurement in the person. So with visceral leishmaniasis, there will be fever lasting for weeks or months, weight loss, weakness, enlarged spleen and liver, known as splenomegaly and hepatomegaly. Then anemia, when you have low red blood cells, low white blood cells, low platelets, swollen abdomen and darkened skin, and it can lead to death eventually if it's left untreated. So leishmaniasis can actually look like other diseases. So we're looking at the differential diagnosis now. So for example, skin ulcers. So skin ulcers that are caused by fungal infections or maybe tuberculosis of the skin, syphilis, or cancers. Then also for the visceral leishmaniasis, so the symptoms that it causes due to the organ involvement, we can also see such symptoms in like malaria, typhoid fever, lymphoma, or leukemia. So we can see similar symptoms here. And also for the nasal involvement in mucocutaneous leishmaniasis, so we can see some of those signs in fungal infections, syphilis, and some nasal cancers. So for the treatment depends on this type and the severity of the leishmaniasis. So medications used are known as anti-leishmanial drugs. So for example, we have sodium stibogluconate or meglumine antimonate. So they are injections used for many forms of leishmaniasis. Then we also have liposomal amphotericin B, which is used especially for visceral leishmaniasis. And there's also a drug known as miltefosine, and this is actually an oral medication for some types of leishmaniasis, especially cutaneous and visceral. Then in some cases, paromomycin is an antibiotic, so in some cases it's used. Supportive care too can be given, like nutritional support, especially in visceral leishmaniasis, where the person has anemia, the person has weakness, all those kind of things. So it's very essential in this particular kind of leishmaniasis. Then treatment of the anemia and the infections is also part of the supportive care. So we could give blood tonics, and also a wound care for skin ulcers. So when it comes to the management and how we can prevent this leishmaniasis, number one, avoiding sandfly bites. Like, try to use insect repellents. If you are in an endemic area, try to use insect repellents, wear protective clothing, and sleep under insecticide treated nets. Then spray insecticides too, like control the sandfly population by spraying of insecticides. Clear, if you are living around bushy areas, try to clear the bush, and clean your animal shelters too. Then usually early detection and treatment is actually important to prevent like serious complications of this condition. And it's good to have community awareness in endemic areas, which could help reduce the cases of this leishmaniasis. So in summary, leishmaniasis is a parasitic infection that is spread by the female sandflies, and it causes skin sores, mucous membrane damage, or several internal organ disease. So it mostly affects people in tropical regions, and it can lead to serious health problems or death if left untreated. And treatment is done with special antiparasitic medicines, anti-leishmanial drugs, and prevention involves avoiding sandfly bites and basically just improving your hygiene. So that has been the breakdown of the condition known as leishmaniasis. I hope I was able to convince you and not confuse you. So I'll see you in the next video. Bye.